So, good evening, everyone. Welcome to A Place to Call Home, Living Comfortably with Mental Health Conditions. My name is Matt Gasecki, and I am the Community Outreach and Education Coordinator with NAMI Greater Cleveland. And I am very happy that so many of you have joined us tonight for our community education program on mental health considerations and housing. I'm joined tonight by Tanesha Hunter with the Fair Housing Center for Rights and Research, and we're very excited to be bringing some more awareness and knowledge and expertise from Tanesha on this topic that is very important and personal for many of you. A few housekeeping notes. We will be ending by 7 o'clock tonight. If you have questions, please utilize the chat feature. I will be monitoring the chat throughout the presentation, and we'll be taking time to gently interrupt Tanesha, our presenter, if the questions are pertaining directly to what she is currently describing on her slides. And hopefully we will also have time for more general questions at the end of our presentation tonight, as well as an evaluation. This program is being recorded, so if you're not comfortable being on camera, make sure you have your camera video turned off. And for those of you that are not familiar with NAMI or NAMI Greater Cleveland, I'm going to just provide a little bit of an overview of who we are and what we do. NAMI is the National Alliance on Mental Illness, and it is a grassroots organization that was founded in 1979 in Wisconsin by a group of mothers of children with mental illness who were dissatisfied by the lack of support, education, and acknowledgement in their local communities and in society more broadly around the reality of living with mental illness. NAMI is now represented by state and local affiliates in all 50 states, and it is the largest grassroots mental health organization of its kind. NAMI Greater Cleveland is the local affiliate serving Cuyahoga County in Northeast Ohio, and our mission is dedicated to empowering those living with mental illness and their families to achieve a better quality of life by providing support, education, information, and referral and advocacy. We offer support groups and educational courses for people living with mental illness, for their families and loved ones, and also do community education programs like this. We also provide a helpline that is staffed Monday through Friday, 9 to 5, where trained staff, volunteers, and interns can provide assistance with locating resources related to mental health, as well as other community concerns. And that may be a helpful resource for many of you with questions about housing for your loved ones with mental illness on tonight's call. We also support advocacy in the sense of raising awareness about mental illness, reducing stigma, and supporting national and state level legislative efforts to promote greater access to mental health, more humane options for mental health treatment, and more funding for mental health. So that is NAMI Greater Cleveland in a nutshell. And with that being said, I am going to turn it over to Tanesha to provide our presentation for which we are all here tonight. Go ahead, Tanesha.
Great, Matt. Thank you so much. Thank you for having me this evening. So before I get started, I just want to note that this seminar is going to be really fair housing law specific. And since we are talking about fair housing law, I just want to note that I am not an attorney and we do not have any attorneys on staff at the Fair Housing Center. So this is going to provide general information. And if you have specific legal questions, we do ask that you consult an attorney for those specific legal questions. Let's go ahead and get started. Let's see, let me try to advance my slide here. Great. Okay, so first, let me tell you a little bit about the Fair Housing Center if you are not already familiar. So the Fair Housing Center for Rights and Research is a not-for-profit fair housing agency, and we promote equal housing opportunities as well as positive race relations throughout Northeast Ohio. And we really drive our mission, which is to protect and expand fair housing rights, eliminate housing discrimination, and promote integrated communities through some core services. Those services include direct advocacy. So if folks believe that they are being discriminated against, they can give us a call, and one of our advocates for free will walk them through the process, which might even include complaint investigation. Enforcement, we regularly monitor different sales and rental streams to make sure that they are not having discriminatory practices. Research. Our research team is absolutely phenomenal. If you have never had the opportunity to take a look at some of our publications, I definitely invite you to do so, to go to our website and take a look. We have different maps and publications that we put out annually that address different barriers to fair housing all throughout Northeast Ohio. And then just like today, we do education and community engagement. So both housing providers are knowing their obligations under fair housing law, but then also folks are just knowing their rights as well. So before we get started into the nitty-gritty of fair housing law, let's talk about why fair housing is important. And I have a list that talks about the impacts of housing on the left. But before we even do that, let's focus on what is on the right. Housing is a human right, period. You deserve fair housing if you are a human. When we think about our hierarchy of needs, shelter is at the very top, right? So let's just make that very loud and clear that housing is a human right. But then let's talk about some of the impacts of housing as well, right? Housing stability, quality, safety, and affordability all affect health outcomes, as do physical and social characteristics of neighborhoods. So where you live absolutely matters. Housing impacts your access to quality schools, whether or not your child is going to a failing school district or not, access to healthy foods, whether or not you live in a food desert, your access to jobs, your access to healthcare. Where you live impacts your life outcomes, your opportunity for upward mobility, and your exposure to environmental health hazards such as lead. So having housing free of discrimination is important. So let's talk a little bit about that more in terms of fair housing law. So fair housing is a civil right, and it's protected by federal, state, and local laws. And so the Federal Fair Housing Act was actually signed into law on April 11th, 1968 by President Lyndon B. Johnson. And so again, it's a civil right afforded to everyone living in the United States. If you live in the United States, you are covered by fair housing law. So we have both federal, state, and local fair housing laws that exist to protect people from housing discrimination based on your protected class. And we'll talk about what a protected class is just shortly here. So there have been many policies and practices in place over the years that have really perpetuated discrimination in housing. Whether that was racial residential segregation or, perhaps not allowing women to access a mortgage independently, or even forcing people with disabilities to live in segregated housing. And when that Fair Housing Act was signed into law on April 11th, 1968, that put an end to that sorts of discrimination, right? So the Fair Housing Act's goals is one, to eliminate housing discrimination, but then two, also to promote residential integration and undo the effects of prior discriminatory policies and practices. And this is also known as affirmatively furthering fair housing. So a little bit about what properties is covered under fair housing law. The Fair Housing Act defines the term dwelling very broadly. So here's some examples of covered properties: homes, apartments, condos, manufactured and mobile homes, nursing homes and assisted living facilities, residential recovery housing, transitional housing, dorm rooms, extended stay hotels, and even timeshares, and vacant land intended for residential construction. So just about any property that you can think, residential property that you can think of, is covered under fair housing law. Now for protected classes. So again, we are all members of protected classes when it comes to fair housing. Now, on the federal level, we have 7 protected classes. We have race, so how one identifies their race, whether you identify as white, Black, color, and that can even be intra-race. So that could be perhaps maybe even a light-skinned Black person discriminating against a dark-skinned Black person. Then we have national origin, which includes birthplace, culture and language, religion, sex, familial status, and disability. We are going to talk about just a little bit more in depth. So hold your thought on there. Then in Ohio, we have some additional protected classes. So in Ohio, ancestry, which is a somewhat more broader term than national origin, and then also military status is protected. Then in Cuyahoga County, we also have some additional protections. So in 2018, the Fair Housing Ordinances was passed to include sexual orientation and gender identity in Cuyahoga County. However, recently, the Biden administration expanded protections for the LGBTQ plus population. So it is effective that sexual orientation and gender identity is actually included under the basis of sex in federal fair housing law, right? So all over the country, this is a protected class, whereas ever since 2018, it was a protected class in just Cuyahoga County here locally, but now federally, all across the board, it's included under the basis of sex, sexual orientation, and gender identity. Then locally, so depending on what city you may live in, there may be some additional protected classes, and that might include, age, marital status, parental status, source of income, which we are going to talk about just a little bit later into the presentation, creed, ethnic group, occupation, and then physical characteristics and even associations with a protected class. So it's very important to note, perhaps you've moved from, a different city recently. It's important to note the local legislation on fair housing law because different cities offer different protected classes. Then protection on the basis of sex. I said that we go a little bit further in depth with this. This includes one sex, so whether or not you identify as male or female, also includes one's sexual orientation and one's gender identity. Then one's status as a victim of domestic violence, regardless of the sex of the victim. So as you know, women tend to be domestic violence victims, but however, it can happen to anyone. It can happen to a man or a woman. And so it's regardless of the victim's status. And then also sexual harassment. And to give you a couple examples of this is when a landlord or housing provider or a contractor even is being sexually suggestive, right? They are saying, perhaps if you give me your phone number, then I'll give you your next month's rent for free, right? This is completely discriminatory in sexual harassment and a fair housing law violation. Furthermore, protections on the basis of familial status. This covers households with individuals under the age of 18 living with a parent, legal custodian, or designee. This also includes individuals who are pregnant, an individual in the process of securing legal custody of an individual under the age of 18. So that might include foster parenting and adoptions. And we'll talk about in just a little bit here, what are some discriminatory acts that constitute fair housing discrimination just shortly here. So mental health in your fair housing rates. So first, let's talk about some applicable laws. So both the Fair Housing Act, the Americans with Disabilities Act, also known as the ADA, and Section 504 of the Rehabilitation Act all protect individuals with disabilities from discrimination in housing. So this includes individuals with mental health, intellectual, or developmental disabilities. Now, These laws often overlap in their coverage, but some housing may be covered by only one of the laws, while others may be subject to all three or just maybe two of the laws. So Title II and III of the Americans with Disabilities Act prohibit discrimination on the basis of disability in all programs, services, and activities of public entities, and even private entities that maybe own or operate or lease places of public accommodation. So for example, if there is an apartment building that has a shared space where people can maybe come and rent that space out to, throw a party, that then space, that public accommodation will be subject to ADA. So that's a little bit about the laws that cover housing. Now let's get a little bit into disability as it's defined under the Fair Housing Law. Okay, so a person is protected as a person with a disability under Fair Housing Law if they meet one or more of the following conditions. They have a physical and or mental impairment which substantially limits one or more major life activities. They have a record of having such impairment, being regarded as having such impairment. So how one perceives you, right? Someone may look at you and, perceive you as having a disability. Then also includes people associated with or residing with a person meeting definition. So to give you some further examples, this includes chronic mental illness, which might include, anxiety or depression. This includes hearing, mobility, and visual impairments. This also includes cancer, AIDS, HIV, developmental disabilities, and then also alcoholism or past drug abuse. These are all considered to be covered disabilities under the Fair Housing Act. The Fair Housing Act, however, does not protect current illegal drug users. And we get a lot of questions or concerns about marijuana use. As you know, in Ohio, medicinal marijuana use is allowed. It can be, consumed or vaped, not smoked, but consumed or vaped. However, federal law still recognizes marijuana as a Schedule I drug. And so as a fair housing advocate, what I can say is that if a person is needing their medical marijuana as a reasonable accommodation so that they can enjoy their home equally, right? They can't overcome their, their anxiety or whatever it is without their medical marijuana, then as a fair housing advocate, then I would advocate for individuals being able to use that, even though there's a conflict there between federal and state law. However, let's see, I think we have a question.
Yeah, so the question is, do you have to be under the care of a professional to be defined as meeting criteria for mental health?
Yeah, that's a good question. So actually, it can be, again, it can be how someone perceives you. So it can be you having a record of having such condition. It can be how one maybe perceives you, and then even association with. So for example, an association with would be, there was a case where a woman had a service animal. She had an emotional support animal as a pet bull, and she was going to visit her boyfriend in an apartment complex. And in that apartment complex, they had, this rule that pets weren't allowed, pit bulls weren't allowed. But however, even though this woman didn't live in that apartment complex, even though she was visiting her, significant other there, fair housing law still pertained to her as well, still pertained there as well. So it's being associated with a person with a protected class. We'll talk a little bit about documentation and what sorts of documentation landlords might be able to ask when we talk a little bit about reasonable accommodations and modifications in just a couple slides here. Going back to the exemptions here on who the Fair Housing Act does not cover. Again, current illegal drug users, and then also anyone who poses a direct threat to the health and safety of others or causes substantial physical damage to the property. Okay. Okay, let's talk a little bit about the occurrence of discrimination on the basis of disability. So according to the 2020 National Fair Housing Alliance annual trend report, complaints alleging discrimination because of disability continue to account for the largest number of complaints at almost 60%. So no matter where you are in the United States, it's likely that disability is going to be the number one complaint when it comes to fair housing concerns. And even according to a 2017 research report released by HUD, it showed that persons living with mental health conditions face significant housing discrimination in the rental housing market. So some of the things that that report found was that persons living with mental illness were less likely to receive a response when they were inquiring about housing. They were less likely to be told that an advertised unit was available. They were less likely to be invited to actually contact a housing provider. They were less likely to be invited to, inspect unavailable units, like to come through and walk and take a look at it. And they were also less likely to be encouraged to look at, they were more likely to be encouraged to look at a different unit than the one advertised. So say, for instance, someone called in and looking for a particular unit, and then once they get there, they're told, oh no, actually this one isn't available, but we have this one in this other building back here. Those were some of the sorts of discriminatory actions that were found in that report that was released. So what sorts of coverage does the Fair Housing Act offer to combat this sort of discrimination, right? So I told you before, the Fair Housing Act was signed into law in 1968. And when it was first signed into law, there were only 4 protected classes. There was race, color, religion, and national origin. Sex was added in 1974. That really went along with the women's rights movement. And then disability and familial status weren't amended into the Fair Housing Act until 1988. So we're just talking about maybe 33, 34 years now that disability has even been included as a protected class. But when the Fair Housing Act was amended, some additional protections did come into place. And of those additional protections includes reasonable accommodations, which equal a change in policy, and then reasonable modifications, which equals a physical change to a property. So these are both, this is both accommodation and a modification to either a housing provider's rules or policies so that a person can enjoy the dwelling equally, and then a modification to the physical change of the property so that a person can enjoy the dwelling equally. And we'll talk about that in just a second here. So a reasonable accommodation is, again, a change in the policies and procedures that govern the residents. The accommodation must be related to a person's disability, cannot cause an undue financial and administrative burden for the housing provider, and then cannot be a fundamental alteration of the normal services or provision that the housing provider offers. And so when we talk about cannot cause an undue financial and administrative burden, a quick example is, say the accommodation that we are asking for a housing provider is, say a person with a disability has just recently lost their job and they're no longer able to pay rent. So they're asking for the housing provider to allow them, to not pay any rent because they've lost their job. That would cause an undue financial and administrative burden for a housing provider. So that might not be allowed. But as long as it's not causing an undue financial and administrative burden, then the housing provider must grant the accommodation if it meets these criteria. So let me give you some examples of what reasonable accommodations might look like. Allowing a service animal despite having a no pet policy, informing others, whether that be a social worker, family members, of different policies and procedures. Allowing a non-tenant to use a laundry room. So, if a person, for instance, isn't capable of doing their laundry themselves, allowing another person to come into the home to use their laundry so that they can get that fit done for the person. Moving from one unit to another without a fee. reserve parking spaces, allowing a live-in aid, and then changing the rent due date. So say, for instance, a person receives their check on the third Wednesday of the month, right? But your rent is due on the first. Allowing that person to change their rent due date to the day that you receive a check, so that it's more manageable for you to pay your rent. And then, of course, also engaging in utilizing the Ohio Relay Service. A little bit more about assistance animals. So many people have this, misconception that the ADA and the Fair Housing Act has the same requirements when it comes to assistance animals, and that is not the case at all. The Fair Housing Act and the Americans with Disability Acts have different definitions of assistance animals. So the Fair Housing Law actually allows a much broader definition of assistance animals when it comes to reasonable accommodations. So there are actually two types of assistance animals. There are service animals that help out with specific tasks, such as maybe guiding a person who is visually impaired, alerting a person who is hearing impaired to sounds. And then we have emotional support animals. And emotional support animals, might help relieve depression, anxiety, and stress or stress-induced pain. People can need an emotional support animal for a number of reasons, and there is no specific training requirements or there are no breed restrictions when it comes to emotional support animals. A person can have an emotional support pit bull, an emotional support ferret, an emotional support bunny. There's no specific training requirements. And so breed, size, or weight limitations do not apply to service or assistance animals. And housing providers cannot collect pet rents or pet deposits from tenants who actually need their animals as an accommodation. So if there is an apartment complex that has a no pet policy, if a person is needing that an emotional support animal to help them cope, then they can ask for a reasonable accommodation, even though this housing provider has a no pet policy, so that they can enjoy the dwelling equally, right? A person can't just be turned away because they have an emotional support animal, as long as they have asked for a reasonable accommodation. And again, if it's not causing the housing provider undue financial or administrative burden, then that housing provider has to grant that policy.
Tanesha, we have a question from
Yes.
someone, which is, how are fair housing laws applied to accommodations at a homeless shelter?
So again, all residential, about all residential properties are covered under fair housing law. So if there is an accommodation that needs to be made in order for a person to enjoy the dwelling equally, then they can then, ask for that accommodation, put it in writing, whatever it may be. So if it may be, need for an emotional support animal or a change to some sort of modification, and we'll talk about modifications just shortly here, then they can put in that request for the housing provider to make that accommodation. And if a person is needing some assistance in making a reasonable accommodation request, then they can definitely give our office a call, and we can assist someone with writing a letter to housing providers to make a reasonable accommodation request. Okay. Another item I wanted to talk about when it comes to reasonable accommodations is caregivers in fair housing. So a live-in aid is defined as, a person who resides with one or more elderly persons, near elderly persons, or persons with disabilities, who is determined to be essential to the care and well-being of the person, would not be living in the unit except to provide the necessary supportive services, and it still must comply with occupancy standards. So, if a person is needing, full assistance with their ADLs, with their activities of daily living, and they need a care provider, and that care provider can be a family member, right? A care a care provider doesn't have to be someone who is necessarily paid out of a home health aid organization. The care provider could be a family member as well. As long as it's meeting the occupancy standards, a housing provider would need to grant that as a reasonable accommodation. Now, a housing provider could still do a criminal background check on a caregiver residing with someone, but they wouldn't be able to do a credit check or anything like that because that person isn't there to pay rent. They're there to be a caregiver. There was a case of a gentleman who was a quadriplegic, and his aide was coming in every day to assist him with his activities of daily living. And there was a designated parking spot for this gentleman, and his aide would come and park in his parking spot so that she would be able to do these services for this gentleman. And the housing provider towed her car because she wasn't a resident of the property. So even though this gentleman wasn't utilizing this parking space, and needed this person to park close to the building to provide care, they towed her car away because she wasn't an actual resident. And a reasonable accommodation request was put in. They still denied it, and then that case actually went to court and I believe was settled. I think we have a couple more questions. Let me just take a quick
looks like we have two scenarios that two of our participants are currently experiencing. Do you want to take the time to answer those right now?
Let's go through, because I may talk a little bit more when it comes to discriminatory acts. So let's go through the presentation and see if I answer those. And if not, we'll get to them if time permits at the end. So now that we have talked about reasonable accommodations, which again are a change in policy so that someone can enjoy the dwelling equally, let's talk about reasonable modifications. So a reasonable modification is an actual physical change to the interior of a tenant's own unit or to the common area. So for instance, if there's a lobby, perhaps installing a ramp into a lobby so that a person can enjoy the dwelling equally. The tenant is actually responsible for requesting the modification from the housing provider. So as a tenant, you're responsible for requesting the modification and accommodations. However, just as again with the reasonable accommodation, it must be related to the person's disability. It can't cause an undue financial or administrative burden, and then it can't be a fundamental alteration of the normal service provisions. As long as the housing provider, the modification meets this criteria, the housing provider has to grant that modification. So a couple examples of reasonable modification requests will be widening doorways, installing grab bars, lowering heights of kitchen cabinets, installing a ramp, installing automatic water faucet shutoffs, installing or removing carpeting, lowering or raising the height of switches, outlets, and thermostats, and then also installing those lever door handles that you see pictured there instead of the orbital ones that you typically see on older homes. So this is just one of the quotes from one of our clients in talking about his experience with housing discrimination and his reasonable modification requests. He just stated that, it was so much better when I can, pull up to my door and can walk upstairs with banisters. When I go to take a shower, I've got railings to hold me up, not being afraid of falling and hurting myself. Because what we have to realize is that these additional protections were put in place so that folks can enjoy a dwelling equally. And it's likely that if these accommodations or modifications aren't put in place, then, someone isn't enjoying their dwelling or living freely how they want to, whether that be, putting an extra lock on a door because of anxiety concerns, or whether that be asking for a ramp installation or grab bars, denying a person a reasonable accommodation or modification request is restricting housing choice. And so that's why it's important for folks to know their rights and for housing providers to know their obligations to grant reasonable accommodation and modification request. So the process for requesting reasonable accommodations or modifications, a tenant can, just going over tenant rights here, a tenant can ask for more than one reasonable accommodation or modification. It might be necessary for a person to have multiple reasonable accommodations or modifications. They can ask for accommodation or modification at any point during the occupancy. You don't have to disclose that you need this accommodation before you sign your lease. Something can come up a couple months into you living at a dwelling, and then you would need the accommodation. So any point during the occupancy, the application process, the leasing process, or any time while occupying the unit can these requests be made. A little bit about the obligations for a housing provider. A housing provider can ask for proof of the disability if it is not apparent, right? If it's not readily apparent, then a housing provider can ask for proof. The proof that the person with a disability requires the requested accommodation because of their disability. And this letter can be from a medical or social service provider or with someone who has intimate knowledge of the disability. However, the housing provider cannot ask questions into the nature or the extent of the disability, right? You do not have to disclose your diagnosis to someone. You only need to let them know that you have a covered disability under the Fair Housing Act and need either this reasonable accommodation or modification to enjoy the dwelling equally. And again, the letter can be verified by a medical provider, a social service provider, case manager, or someone with intimate knowledge of the person's disability. So a housing provider cannot ask questions about the nature or extent, require that the person with a disability disclose a diagnosis, ask for medical records, or ask how long have you had this disability, charge fees for any of the reasonable accommodations. So any changes into the policy, charge fees for those. That of course would not be allowed. Now you as a tenant you can provide as much information as you would like to and that you feel comfortable with, but these are the core things that you are required. Just a simple letter that states that you have a covered disability. You don't have to disclose your diagnosis if you don't feel comfortable doing so. So paying for modifications, it is actually the responsibility of a tenant to pay for a modification. So if there does need to be something done, there needs to be, carpeting removed, there needs to be a ramp installed, there needs to be, the door handles changed, that cost is on the tenant. There are two instances when a housing provider might be required to pay for that though. That's if the building that the person is living in receives federal financial assistance, or the building was built for first occupancy after March 13th, 1991, and the modification is covered under what we consider as new construction requirements. And we'll talk a little bit about that in just momentarily here. So if you might be confused whether or not a tenant is needing to pay for a reasonable modification, and you're not quite sure in what circumstance it will be required, you can definitely always give our office a call so that we could give that information to you. I'm gonna slide through these couple next slides because I want to give time at the end for any questions. Real quick, I do want to note though, with reasonable modifications in public housing and project-based housing, these are all buildings that receive federal financial assistance. The housing provider is required to pay for those modifications. However, housing choice vouchers, even though a person is receiving federal financial assistance, the voucher is connected to the person and not the housing unit. So therefore, the person in those circumstances, if you're a housing choice voucher recipient, you would actually be required to pay for the reasonable modification, not the housing provider. Okay, so just a couple situations to kind of get a better handle on reasonable modifications or reasonable modifications and accommodations. So this first one in situation A, a tenant is in a severe car accident, and as a result, the tenant will need to use a wheelchair permanently. This is going to be a reasonable modification request because we're asking for a physical change of an installation of a ramp. Okay. The next situation, in situation B, a person has suffered an injury resulting in difficulty reading and comprehending written words. This is going to be an accommodation request because we're asking for a change in a policy. And this is going to be the request that we're going to make is, a phone call to the tenant to actually convey important messages instead of sending written correspondence. Walk you through the process of requesting reasonable accommodations here. The tenant makes the request. So you want to write the request out, put it in writing, email it. A housing provider is supposed to take requests, whether they're verbal or written, but to ensure that, you have some documentation, you want to write it out or email it so that you have it. A housing provider must respond in a timely manner. So if you are asking for a modification or an accommodation, that has to be responded to in a timely manner. They can't just put you off to the side, 30 days, 60 days go by, and your request hasn't been addressed. Either they're going to grant it or they're going to deny it because it's causing an undue financial or administrative burden. But a timely response should be given. Again, housing provider can ask for documentation if the disability is not readily apparent, if the connection is not clear. And that documentation can be provided by a medical, social service, mental health professional, or someone with intimate knowledge of that person's disability. The letter is not required to disclose your diagnosis or any, the nature or the extent of the disability, but any information that you feel comfortable, you can include in the letter. Again, that letter only needs to state that, there is a covered disability under the Fair Housing Act that impacts one or more major life activities, and I'm requesting this reasonable accommodation or modification due to that disability. That's it. So gonna go into prohibited acts. So we talked about a lot. We talked about covered property. We talked about protected class, right? We are all afforded the right to fair housing based on our membership of a protected class. We are all members of a protected class. Then we talked a little bit further in depth about additional protections afforded to folks, to persons with disabilities. Now let's just dive a little bit into prohibited acts. So what actually constitutes fair housing discrimination is the refusal to sell, rent, negotiate, or otherwise make unavailable or deny a dwelling. So again, I gave that example earlier. Say for instance, a person, a woman, a family with 2 kids who is trying to rent an apartment. And, she goes to go rent the apartment. And once she comes with her children, the person says, oh, no, we can't rent to you because you have children. That will be a fair housing violation. Discriminate in the terms, conditions, or privileges of sale or rental of a dwelling or in the provisions of services or facilities. So if you are being offered different terms than everyone else, right? If they're making you, have a double security deposit, if they are making you sign an extended lease, if they are, any sort of differences in the terms or conditions in the sale or rental of a dwelling will be a discriminatory act. Now, a lot of people say, well, how am I supposed to know if I'm being discriminated against? If you feel, or how am I supposed to know if I'm being treated differently, right? You may not have access to the information of other folks who live in your apartment complex. If you feel like you may be being discriminated against, you can definitely give our office a call so that we can talk to you more about that issue so we can investigate it. And we even do something called testing, where we send out secret shoppers so that we can ensure that folks are, legitimately being discriminated against and have evidence to prove that. Then making print, publish, or any notice or statement or ad indicating a preference or limitation based on a protected class. So, saying, no children allowed, saying, we don't accept disability income, things of that nature, making any preferences in the advertising for a rental unit. Misrepresenting availability. Again, you call in to an apartment and they say that it's available, but then when you come in and they take a look at you, then they say, oh no, actually this is not available. If you have reason to believe that you're being discriminated against, you definitely want to give our office a call so that we can talk through that more. Denying a reasonable accommodation or modification request. And then this one right here, this last one is huge. Intimidating, threatening, or interfering with or retaliating against a person who is exercising their fair housing right. So if you do think that you are being discriminated against and you make a complaint, and maybe the housing provider didn't necessarily mean to, intentionally discriminate or whatever the case was, if they go and then retaliate against someone because a complaint is being made, if it wasn't a fair housing violation before, it's definitely one now because of the retaliation aspect. Source of income, wanted to touch on this real quick. When you pay your rent, your housing provider should accept all of your sources of income, including any disability you receive. So housing providers should also allow for third-party rent payments, such as a payee service or funds held in a trust for someone with a disability. So if a landlord refuses to accept any income that's related to disability income, you may have a valid fair housing complaint. Then there are certain communities in Northeast Ohio that have source of income as a protected class. So this is how someone pays their rent. So if you're using a housing choice voucher, if you're using a voucher from CMHA, from Eden, if you're using emergency rental assistance, whatever the case is, your source of income is protected in these municipalities in Northeast Ohio, and that includes Akron, Cleveland Heights, Lindale, South Euclid, University Heights, Warrensville Heights, and Wickliffe. So if you are looking for housing in those communities and you're seeing things like no Section 8 allowed or no housing choice voucher recipients or no vouchers, that's completely illegal in those cities, and you'll definitely want to report that. Real quick, it's also unlawful. So applications, rental applications, if they are asking any information regarding a protected class, so if they're asking about disability status, if they're asking about whether or not you have children on the application, if they're asking your race, that is, based on Ohio's fair housing law, that will be a fair housing violation again as well. So you want to take a look at those applications if you are looking for a rental property, or if you've, in the past, if you looked for a rental property and you saw an application that had any questions pertaining to a protected class. So as we kind of wrap it up, who can make a complaint? Anyone. We are all members of a protected class. Where can a complaint be brought? It can be brought with HUD, the Ohio Civil Rights Commission, and then also with local fair housing agencies as well. Who can be sued? Housing providers, real estate agents, contractors, property managers, cities. The list is exhaustive. Role of the government. The role of the government is to enforce fair housing law, right? What's the purpose of having these sorts of laws in place if they're not being enforced? And then the role of fair housing groups is to allow for, really advocate for individuals, make sure that folks are understanding their fair housing rights, and making sure that housing providers are understanding their obligations to fair housing. And so I'm going to wrap it up real quick so that we can at least maybe try to answer one or two questions. This is just something that I really want to drive home. I know this was a lot of information and it was quick, but if you find yourself having questions that weren't answered during the presentation, please feel free to reach out to me. Please feel free to call our organization, because that's exactly what we're here for. Which is a quote from one of our past clients. And it states, the issue is not just about housing. It's about fairness, it's about freedom, and it's about understanding your rights as human beings, because I can't drive home the point enough that, housing is a human right. And when we think about policy, when we think about how we react to affordable housing and just the complexity of housing needs in general, I don't think that a lot of folks put that into the forefront, that housing is a human right. So I want folks to sit with that. But the goals of fair housing, again, is one, to reverse decades of discriminatory policies, foster inclusive communities, and then allow everyone equal access to the housing of their choice, because where you live matters. And then also increase diversity in schools, because we know that folks, when they're young, when they're exposed to more diverse situations, they're better accepting of diverse situations when they are adults. And to the point, when I talk about where you live matters, housing is inextricably linked to health. And I've often heard it said that your zip code is a better determinant of your health than your actual DNA makeup. So housing is critical to many other facets of life, including physical and mental health, quality of life, access to education, economic outcomes, all surround where you live. So, safe, stable, and affordable housing is a necessity, and, achieving, and it is a necessity to achieving even having other human rights met, right? Having your security and your safety nets met. It's just literally the gateway to everything. And so that's why it's so critical that barriers aren't being put into place when folks are trying to find housing. So because the concept of safe, decent, and affordable housing is so complex, and we really honed in on it tonight through a fair housing law lens, I wanted to also just provide some additional resources, because I know folks may just have questions or just other comments in general about fair housing as it pertains to other aspects. So some quick resources here to note: the Cleveland Housing Court has mediation and rent deposits. Legal Aid Society, of course, has a tenant information line if you're having landlord-tenant concerns. Rights to Counsel is a free legal program for Greater Cleveland residents to assist with evictions. Emergency rental assistance through Cleveland Housing Network. The Cleveland Metropolitan Bar Association for attorney referrals. Step Forward, which is formerly CEOGC for emergency assistance. NEOC for tenant organizers, and then also 211 first call for help. I believe Matt will share these slides though, so that you have this resource page available. And so I know that I only left a few minutes here for questions. I really appreciate your time and you sitting through and listening. And I guess we'll see if we can answer a few questions before we leave tonight.
Yes, so thank you. We got a nice comment from Cynthia. Says, this has been the most important issue I've faced in supporting my son. Thank you for this amazing presentation. Thank you, Tanesha. Just a nice comment for you there. Maybe a quick question. April asked, can a legal guardian qualify as a caregiver? I'm wondering if this is perhaps in relation to the live-in aid that you were describing earlier. Can a legal guardian qualify for that?
Yeah, so I believe so. I believe again, a caregiver can be anyone who is taking care of that person when it comes to a reasonable accommodation. And the aspect that I was talking about it in is having someone come in to live to help to assist that person. And so, yes, a legal guardian can be considered as a caregiver to come in to assist that person with their, activities of daily living, or, whatever they may be. It could be a family member, or it could be a paid healthcare provider.
Another question that we had was from Jonathan. Jonathan says, currently I work for a mental health agency as a peer support specialist, and recently looked into helping a peer I'm working with that has a mental health diagnosis get access to a transitional housing location. One of the staff members at the housing location stated that they could not provide housing for my peer due to his psychiatric vulnerability, as there was no one on staff to manage his medications. Is this a form of housing discrimination?
This could potentially be, again, we have to talk about that undue financial and administrative burden, right? So if they have a staff shortage and can't provide the service, then, allowing your client to live might need, they might require them to then have some additional staff persons that they may not have the capacity for. So we have to look close at that undue financial or administrative burden aspect of it, of the denial. But it's definitely something that one of our advocates can look into specifically. So Jonathan, if you want to, pass me an email, and I think I'll just drop my email here in the chat for folks. If you want to shoot me an email, we can talk a little bit more about your case to examine it a little bit more. But that's one of the key things, is that if it is causing an administrative or financial burden to the housing provider, then that is a reason for denial. And I just put my email in the chat there.
Another question we have raises an interesting point about housing and COVID. Jennifer says, I have a brother in a group home, and the group home owner has not let me into the home since COVID, and still to this day doesn't allow me in easily because of COVID. She tries to block me every time. My brother doesn't get the attention and assistance he needs. Is there anything I can do?
That's a very good question. When it comes to COVID policies, COVID has really shaken things up in the housing world, and it's still a lot being known. And we still haven't seen any case law be presented regarding COVID. What I would say is that COVID protections, because we're still learning a lot about COVID, right? We're learning more and more that people have long COVID. Now, if your brother specifically has had COVID and they're not allowing you in because of that, that might be a reason on their end to, to protect the safety of the people, the residents that live in the home. But if it's just a general policy, it may be worth looking into an advocate, even maybe perhaps even an ombudsman, to look into a little bit further to make sure that your brother's needs are actually being met. So even though their policy doesn't allow for you to come physically see your eyes on, maybe you can make accommodation request for maybe perhaps an ombudsman or another staff member to have eyes on your brother, just to ensure that he's getting the proper services that he would need.
And another question from Marilyn is, does the Fair Housing Center help to obtain housing for someone with mental illness?
So we don't specifically assist in obtaining housing. We, of course, if you give us a call and you're looking for housing, we definitely have, different resources and lists that we can provide to folks. That's not one of the key services that we provide. We more so, prevent and try to assist folks who believe that they are being discriminated against. So if you believe that you are having barriers to finding housing because of a mental health condition or a disability or anything listed as a protected class, because you have, whether it be because you have children or because it be your race, religion, whatever the case is, if you are having barriers because of a protected class, then give us a call, because we may be able to assist you in weeding out those barriers.
Well, we are at 7 o'clock. Just a reminder for everyone to please complete the evaluation for this presentation. I've been putting the link to the SurveyMonkey evaluation in the chat. Thank you so much, Tanesha, for generously donating your time and your expertise for us tonight. Reminder that this webinar is being recorded. It will be posted to the NAMI Greater Cleveland YouTube channel later this week. And the slides will also be shared with all of you. I'll probably send them out in an email tomorrow. So you'll have access to all these references and resources and contact information for the Fair Housing Center later tomorrow. Thank you all for joining us and hope you have a great Tuesday.
Thank you.
Bye.